Imagine this. You're a soldier, a prisoner, or just a kid in an orphanage. One day, doctors show up, trusted figures in white coats. They promise care, but instead, they deliberately infect you with syphilis or gonorrhea. No consent, no cure. This wasn't a nightmare. It was real, and it happened in Guatemala in the 1940s, orchestrated by U.S. and Guatemalan doctors. Hidden for over 60 years, these experiments shocked the world when uncovered in 2010. Today, we're unpacking the hidden U.S. experiments in Guatemala, a story of medical ethics gone wrong, imperialism, and lasting scars. If you're into dark history or human rights, hit that like button and subscribe for more. Let's dive in. To understand this nightmare, we need context. It's 1946, post-World War II. The U.S. is flexing its influence in Latin America, and the Pan American Sanitary Bureau, think a precursor to global health orgs, teams up with Guatemala's CES government for research. But this wasn't about helping. It was about testing ways to prevent sexually transmitted infections, or STIs, in soldiers. From 1946 to 1948, at least 1,308 people, mostly vulnerable folks, like soldiers, prisoners, mental hospital patients, and even sex workers, were deliberately infected with syphilis, gonorrhea, and chancroid. How? Doctors paid sex workers to transmit the diseases through normal exposure. When that didn't work fast enough, straight-up syringes. No kidding. Then came the follow-ups, invasive exams, blood draws on school kids and orphans to track how the diseases spread. And get this, they add penicillin, the miracle cure for syphilis discovered years earlier by U.S. scientists. But they withheld it. Why? To study the natural progression. This wasn't isolated. It echoed the Tuskegee syphilis study in Alabama, where black men were left untreated from 1932 to 1972. Same researchers, same cruelty. And in Guatemala, it tied into local eugenics movement's ideas of regenerating the population, especially indigenous communities, through twisted science. Survivor Marta Lydia Orellana, who was a girl in an orphanage, later called these inspections medical rape. She and others were jabbed with needles, infected without a whisper of consent. The harm? Untreated STIs led to miscarriages, infertility, organ damage, and kids born with congenital syphilis. Generations ruined. Who was behind it? U.S. Public Health Service Officer Dr. John C. Cutler led the charge. A beloved professor at the University of Pittsburgh, Cutler was also tied to Tuskegee. He locked away records, only sharing with serious researchers. On the Guatemalan side, figures like Dr. Luis Gallic, the health ministry director, greenlit it under the short-lived democratic 10 years of spring government, from 1944 to 1954, when a CIA-backed coup crushed reforms against U.S. fruit companies. Doctors even gossiped about it privately, but officially, buried deep. Fast forward to 2005, historian Susan Reverby stumbles on Cutler's archived papers while researching Tuskegee. What she finds? Detailed logs of the Guatemala horrors. She shares them with David Sensor, ex-CDC director, sparking a firestorm. By 2010, President Obama calls Guatemalan President Alvaro Colom. The United States will take responsibility and apologize. International headlines scream Guatemala's Tuskegee. But apologies don't heal. Survivors sued U.S. institutions like Johns Hopkins and the Rockefeller Foundation, funding sources. But courts dismissed the cases, citing expired statutes. The ripple effects? Distrust in medical research exploded, even echoing during COVID-19 vaccine hesitancy in Latin America. And it spotlights U.S. meddling. These tests happened right before the 1954 coup that installed decades of dictatorships. Coincidence? History says no. One chilling fact: communities knew it wasn't a secret. Whispers spread, but official records whitewashed it all. The hidden U.S. experiments in Guatemala aren't just a footnote. They're a warning. Medical progress at the cost of human lives, fueled by empire and inequality, leaves scars that time can't erase. From Cutler's cold calculations to Reverby's brave reveal, this story demands we question: who pays for science's sins? Thanks for watching this deep dive. If it hit hard, drop a comment. What's the darkest medical experiment you've heard of? Like, subscribe, and ring the bell for more on forgotten histories, like the Puerto Rico cancer scandals or Tuskegee's full story. Sources in the description, including the original OAH piece by Lydia Crafts. Stay curious, stay ethical. See you next time.